If you're over 60, there's something important you need to hear today, and it may surprise you. For decades, we've been told that lower blood sugar is always better, that tighter control is the gold standard, that the same targets used for a 40-year-old should apply to someone in their 70s or 80s. But here's the uncomfortable truth many seniors are never told. Those numbers were not designed with aging bodies in mind. I want you to take a breath and listen carefully, because this isn't about blaming doctors. Most physicians are following guidelines they were taught. Guidelines based largely on studies done in younger or middle-aged adults. What's missing from that conversation is how profoundly aging changes the way the body handles blood sugar, medications, and risk. As we age, our physiology shifts. Muscles become less efficient at absorbing glucose. The liver releases sugar differently. Kidneys clear medications more slowly. The brain becomes more vulnerable to drops in glucose. Yet many older adults are still being pushed toward ideal blood sugar targets that may actually increase their risk of harm, rather than protect them. One of the biggest dangers for seniors is hypoglycemia, blood sugar that drops too low. In younger adults, this might cause shakiness or hunger. In older adults, it can lead to confusion, falls, heart rhythm disturbances, and even sudden loss of consciousness. I've seen patients who did everything right according to their chart numbers, yet ended up hospitalized after a single low blood sugar episode. Here's the key point that often gets overlooked. For older adults, especially those over 65, stability matters more than perfection. A slightly higher but steady blood sugar level can be far safer than aggressive control that swings up and down. The body simply doesn't bounce back the same way it did decades ago. There's also the issue of life context. A senior living alone, managing multiple medications, maybe dealing with memory changes, is not the same as a younger person with one condition and no other health concerns. Tight blood sugar control demands constant attention, precise dosing, and rapid correction. For many older adults, that level of complexity increases stress and risk. Major geriatric and endocrine organizations have quietly acknowledged this over the years. They recommend more relaxed blood sugar targets for older adults, especially those with other medical conditions. Yet, these recommendations don't always make it into everyday conversations at the clinic. So when you're told your numbers must be lower, no exceptions, it's worth asking a deeper question. Lower, according to whose body, whose risk profile, whose quality of life? This video is about empowering you with understanding, not fear. Let's talk about where these blood sugar targets actually come from, because this is where things start to unravel for older adults. Most standard blood sugar guidelines were created using large clinical trials that focused on preventing long-term complications, like kidney failure, blindness, and nerve damage. These are serious issues, no question, but here's the catch. The majority of participants in those studies were younger or middle-aged adults, often newly diagnosed, and generally healthier than the average senior. When you're 65, 75, or 85, your priorities and risks are different. Long-term complications that develop over 20 or 30 years may not be the most immediate threat. Short-term dangers, like severe low blood sugar, falls, fractures, strokes, and cognitive decline often matter much more. Yet the target stayed the same. One commonly used measure is A1C, which reflects average blood sugar over about 3 months. For years, many seniors have been told they must keep this number below 7%. But an A1C doesn't tell the whole story. You can have an A1C that looks perfect on paper while experiencing frequent dangerous lows. The average hides the extremes. And in older adults, those extremes can be deadly. Another problem is medication sensitivity. Aging kidneys and livers don't process drugs as efficiently. This means the same dose that works for a younger adult can hit much harder in a senior. Insulin and certain diabetes medications linger longer in the body, increasing the risk of blood sugar dropping too low, especially overnight or between meals. Then there's appetite. Many seniors eat less, eat irregularly, or have days when food just doesn't appeal. When medications are dosed aggressively, but meals are skipped or delayed, blood sugar crashes are almost inevitable. This isn't a failure of discipline, it's biology. Let's also talk about the brain. The aging brain relies heavily on glucose, and it does not tolerate shortages well. Even mild hypoglycemia can cause confusion, disorientation, or sudden weakness in older adults. These episodes are often mistaken for dementia, mini strokes, or just getting older, when in reality, blood sugar is the culprit. And here's something rarely discussed: fear. Many seniors live in quiet fear of their numbers, fear of eating the wrong thing, fear of being scolded at appointments, fear of losing independence if their condition is labeled out of control. That fear can lead to overcorrection, skipped meals, or excessive medication use, all of which increase risk. Modern geriatric medicine recognizes that goals must be individualized. A healthy 70-year-old may tolerate tighter control than an 85-year-old with heart disease and balance issues. There is no single right number for everyone. The problem isn't that doctors are careless, it's that medicine has been slow to fully shift from one-size-fits-all targets to age-appropriate care. And now let's talk about what safer blood sugar targets for older adults actually look like, because this is where many seniors finally feel a sense of relief. You may have spent years believing that if your numbers weren't perfect, you were failing. In reality, for many older adults, aiming for slightly higher targets is not only acceptable, it's medically wise. For seniors without major complications, many experts suggest an A1C range closer to 7.5% to 8%. For those with multiple chronic conditions, heart disease, kidney issues, or a history of low blood sugar episodes, that range may safely extend even higher. These are not signs of neglect. They are signs of personalized care. What matters most is avoiding extremes. Large swings between high and low blood sugar are far more dangerous than a stable, moderately elevated level. Stability protects the brain, the heart, and the nervous system. It reduces the risk of falls, sudden confusion, and emergency hospital visits. Fasting blood sugar is another area where seniors are often pushed too hard. Waking up with a slightly higher number may actually be safer than forcing it down overnight with aggressive medication. Nighttime lows are particularly dangerous because they often go unnoticed. The body's warning signs are dulled during sleep, and many seniors don't wake up when their blood sugar drops. After-meal blood sugar also deserves context. Older digestive systems process food more slowly. A temporary rise after eating is normal and not automatically harmful. Chasing every post-meal spike with medication can lead to overcorrection and later crashes. Quality of life must be part of the equation. Can you enjoy meals without fear? Can you maintain energy to move, socialize, and think clearly? Can you manage your condition without constant anxiety? These questions matter just as much as any lab result. Another important factor is cognitive health. Repeated low blood sugar episodes have been linked to faster cognitive decline in older adults. Memory, attention, and decision-making can all suffer. Protecting the brain often means loosening control slightly to prevent dangerous drops. It's also worth understanding that normal blood sugar ranges were defined using younger populations. Aging changes what normal looks like. Expecting an 80-year-old body to behave like a 30-year-old one is unrealistic and unfair. This doesn't mean ignoring blood sugar altogether. It means respecting the balance between control and safety. It means working with your healthcare provider to set goals that reflect your age, your health history, and your daily reality. If you've ever felt exhausted trying to meet numbers that seem impossible, you're not alone. Many seniors quietly struggle, believing they're doing something wrong. In truth, the problem may be the target itself. Let's talk about how to actually navigate this conversation with your doctor, because knowledge alone isn't enough if you don't feel confident using it. Many seniors hesitate to speak up. They worry about being seen as difficult, non-compliant, or ungrateful. But advocating for your safety is not disrespectful. It's responsible. Start by shifting the conversation away from perfection and toward outcomes. Instead of focusing only on numbers, talk about how you feel. Have you experienced dizziness, confusion, weakness, or near falls? Do you feel anxious about lows, especially at night? These symptoms are clinically important, even if your lab results look good. It can help to ask simple, direct questions. Ask whether your current targets are specifically recommended for your age group. Ask about the risks of low blood sugar at your stage of life. Ask whether your medications could be adjusted to prioritize stability over strict control. These are reasonable, evidence-based questions. Bring context into the room. If you live alone, say so. If your appetite varies, say so. If you've had trouble remembering doses or meals, be honest. Doctors make better decisions when they understand the full picture of your daily life, not just your lab values. Medication review is especially important for seniors. Some drugs carry a much higher risk of hypoglycemia than others. In many cases, safer alternatives or lower doses can achieve adequate control without the same danger. This isn't about doing less. It's about doing what's appropriate. It's also okay to request a geriatric perspective. Not every physician is trained deeply in aging physiology. Asking whether guidelines for older adults apply to you is a sign of engagement, not defiance. You can even ask for shared decision-making, where goals are set together rather than dictated. Another powerful tool is tracking patterns instead of isolated numbers. If you notice frequent lows at certain times of day or after certain activities, that information is invaluable. It shifts the focus from blame to problem solving. Emotionally, it's important to release guilt. Blood sugar changes with age are not a personal failure. They are part of the natural aging process. Tight control that worked years ago may no longer serve you. And that's okay. Family members can also play a role. If you're comfortable, bring a trusted person to appointments. They can help ask questions, take notes, and reinforce concerns, especially if cognitive or hearing challenges are present. Remember, medicine is meant to serve your life, not dominate it. The goal is to keep you safe, functional, and mentally sharp for as long as possible. Numbers are tools, not judgments. At the end of the day, managing blood sugar as a senior is not about chasing youth or forcing your body to meet standards that no longer fit. It's about honoring where you are now and protecting what matters most: your independence, your clarity of mind, your ability to live without fear of sudden lows or medical emergencies. For older adults, the greatest risks often aren't slightly elevated blood sugar levels. They're falls that break hips, confusion that leads to accidents, hospitalizations that steal strength and confidence. Repeated low blood sugar episodes can quietly erode brain health, increase the risk of heart rhythm problems, and accelerate physical decline. These are the outcomes that deserve our attention. It's time to reframe success. Success is waking up steady, not shaky. It's being able to enjoy meals without anxiety. It's sleeping through the night without dangerous drops. It's having enough energy to move, connect, and think clearly. These markers of health rarely show up on a lab report, but they define the quality of life. Blood sugar management should support living, not restrict it. A plan that looks perfect on paper but leaves you exhausted, fearful, or at risk is not a good plan. Aging bodies need gentler, more flexible approaches. They need margins of safety built in. This is why individualized care matters so deeply. Two people the same age can have completely different needs. One may tolerate tighter control. Another may need higher targets to stay safe. Neither approach is right or wrong on its own. What matters is fit. If you take one message from this conversation, let it be this: you are not broken because your numbers change with age. You are not failing because your targets shift. Adjusting goals is not giving up. It is adapting wisely. Healthcare works best when it's a partnership. When your experience, symptoms, and priorities are weighed alongside test results. When fear is replaced with understanding. When safety is valued as highly as control. As medicine continues to evolve, one truth is becoming clearer. Aggressive blood sugar control is not always protective in older adults. In many cases, it's the opposite. Looser, steadier control can preserve function, prevent harm, and support longevity in a way strict targets never could. So if you've been feeling pressured, discouraged, or confused by blood sugar advice that doesn't seem to match your reality, know this: you're not alone, and you're not wrong to question it. Your health journey deserves nuance, respect, and compassion. Aging well isn't about perfect numbers. It's about staying upright, aware, and engaged in your life. And sometimes, the smartest medical decision is not pushing harder, but choosing balance.